afternoon, or evening to everyone. My name is Sherry Brodeur. I'm a program director here in MIT Corporate Relations. So first, we want to wish everyone on the call, your families, your communities, all our very best. We know this is unprecedented times, and we are thinking about all of you. And I've never been more proud to be part of the MIT community. We are mobilizing teams, including faculty, students, and startups, working on every aspect of this crisis, from vaccines and therapeutics to developing new rapid testing kits, new ventilators, new personal protection equipment, and leveraging AI for early or disease tracking and early disease infection diagnosis. So it's really an incredible time to be here at MIT. We are also, of course, focused on the economic impacts of this crisis. And we have started our first series, which was on March 16th. We had 3 faculty members in a webinar format like today, looking at the impacts on supply chain, the society, and the financial systems. So this is the next in a series of several webinars that we will be offering to the greater public and certainly our members to address this crisis. So the format today, I'll be introducing Simon here shortly. I just want to talk briefly about the format today. So he will give 15 or 20 minutes of remarks. Then we'll stop for Q&A. Please ask questions and also rank them, as we will be answering them, or we will be asking Simon the questions based on the rank order of those that are asked. Simon will then continue for another 10 or so minutes with comments, and then we'll break again for questions and answers. So with that, I would like to introduce Simon. He is a professor of entrepreneurship here at the MIT Sloan School of Management, where he also leads the Global Economics and Management Group. He is the co-chair of the COVID-19 Policy Alliance, which is a ground-up effort here at MIT, including students, faculty, researchers, really to address this crisis. So he and Professor Recep Levy lead that, and very happy that Simon is with us today. He's also, I want to mention, the co-author, along with Jonathan Gruber, of the book, the new book, Jumpstarting America, which I highly recommend. And with that, I'll turn it over to Simon. Simon?
Thanks very much, Sherry, and thanks everyone for joining us today. It's really a great privilege to speak with you, and I think also a great opportunity for reasons I will expand on as we go through this talk. As Sherry said, I'm going to start with about 15 minutes to frame the discussion and our thinking. Then we'll do some Q&A, and I'd like to come back to you with a bit more detail on what we're doing in the COVID-19 Policy Alliance, and begin to start you thinking hopefully about ways you can get engaged either with our efforts or the other many efforts that are proceeding, I would argue, on highly convergent paths. And the sooner we all converge, I think the better for everyone across pretty much all dimensions. Now, we are going to share this video widely, and I do find it necessary at the time of a time of crisis to be very clear at the beginning when I am speaking, because I don't know when people are going to view this. So I am speaking at 11:05 a.m. Eastern Time on March 30th, 2020. My name is Simon Johnson. I'm a professor at MIT Sloan. I worked on economic and financial and other crises for about 35 years. I was chief economist at the International Monetary Fund in 2007 through August 2008. After leaving the fund, I ran an operation, a very small policy commenting shop and website called Baseline Scenario, which was extremely active for about 3 years. And I can talk about details and parallels around that if you like. Subsequent to that, or picking up on that, I've been very engaged with national and international policymakers over the past decade, and I've advised Republicans and Democrats over a number of political cycles. In the most recent political cycle and in the current presidential campaign, I was a senior informal economic advisor to Elizabeth Warren. But that was my life before the virus. The post-virus world, as I'm going to argue, is quite different. And in the post-virus world, there is only one problem right now, and I think one enormous issue that will dominate the post-virus world, a world that I expect to continue for many decades. Now, I would also like to say that everything I'm going to present to you today, and all of the discussion, and certainly all the action items that I will lay out before you, come from joint work that I'm doing with Retsev Levy, who's also a professor at MIT Sloan. Retsev is a terrific presenter, and I hope to get him in front of you before too long. His background is 12 years in the Israeli military intelligence special operations. And when you meet Retsev, I think you'll see that perspective coming through in his intensity and his focus and his ability to think strategically. His second career, as he calls it, is in operations management. He's one of the world's leading experts in hospital systems, change within those systems, but also, as you might expect from his previous experience, emergency management. And here's the critical piece: how to prevent emergencies from becoming system collapses or crashes. Now, Retsev and I got together on this issue only just under 3 weeks ago, but we have been working extremely hard. We have a large team of fantastic people, mostly MIT connected, but you don't have to have MIT credentials to participate. And we have at the heart of that a data analytics machine, pulling data together, analyzing data, and a set of practical engagements with policymakers at the federal, state, and increasingly local levels in various parts of the United States. Happy to talk about our primary geographies right now. Our focus in the COVID-19 Policy Alliance is actionable intelligence and operational recommendations, entirely drilling down into and working the entire stack of problems associated with COVID-19. I expect, in all honesty, that this work will last at least through the end of my professional lifetime, which I hope will be a long time from now. Now, why do I say this? And why do I think this is important context to lay before you? Well, as I said before, I've had a lot of experience in different kinds of crises in all kinds of different countries. I spent a lot of time in the former Soviet Union, a lot of time in Eastern Europe. I worked on the Asian financial crisis. I've worked in Latin America. I've worked in other parts of the world, and I had the experience before, during, and after the IMF. And I think the first thing you should do when you realize there's a crisis, when a crisis comes across your screen, and something, or even when you're evaluating a potential crisis, the first question to ask is, what kind of crisis is this? And I don't mean, I don't think that the first question or the most useful question is, what are the underlying causes, or where do we need to be when we get out of this? Those are important questions, and we will get to them, I promise you, for this crisis, just as we and I and lots of other people worked the previous global financial crisis. But I think that the first question is, particularly when you have a really large crisis with potentially devastating consequences for a lot of people, the first question is, how do we stop the crisis phase? How do we stabilize? How do we reach the bottom and turn around and come back? And I think that the key piece, and certainly my understanding of this, was my conversation with Retsev when he laid out for me the precise way in which this was a public health crisis. And that obviously that's clear to everyone right now, but the precise way, I mean, many people still talk about this crisis as an issue of infection and the number of people who are going to get infected. But really, a sharper understanding, I would suggest, comes from a focus on the fact that many people will get infected. Many of those people will suffer only mild cases. Some of them may be completely asymptomatic. In fact, many of us may have COVID-19 now and not know. That's entirely possible given the current state of affairs. But the disease is highly profiling, so it is targeting, and it will kill older Americans, people who have compromised immune systems and difficulties with their heart or lung capacity, and included in the obvious comorbidities, according to the CDC, which is absolutely authoritative on this, and the World Health Organization, is hypertension, obesity, and diabetes. Now, we don't know a lot about this virus, and it's very important to be clear on that. I do not believe that when our knowledge is limited, we should sit in our homes or behind our desks waiting for the knowledge to gradually accumulate before making recommendations. That's not how I've lived my life, and that's not the way I think the world should, or the world in which I participate operates. I think we need to accumulate knowledge. Certainly, we need to build our understanding. We need to put forward hypotheses. We need to test things. We need to review everything. And we have a very strong internal and external review process in our organization, which I'm ultimately responsible for. And I think that the key insight on the public health piece is actually exactly as the WHO said and says, and it's on the front page of our website, which is covidalliance.com. You need to flatten the curve, meaning you need to slow down the rate at which people come into hospitals and need emergency care, and particularly ICU care. When you don't slow it down enough, and this is what happened tragically in northern Italy, in Lombardy, and for example in the town of Bergamo, the hospital becomes swamped. It is very hard for them to provide adequate care to everyone coming in. A lot of COVID-19 patients, frankly, die. And a lot of non-COVID-19 patients also die, because if you have a sufficiently severe heart attack, stroke, or head trauma, you can't get medical attention, and the results of that are also tragic. Now, we call this, and this is a term coined by Retsev, a hospital crash. That means that your hospitals, including potentially very big hospitals, will go offline and no longer be able to provide adequate emergency service and protection to everyone. And when you start to think about that, when you realize that we have here a public health emergency, it has obvious economic and financial consequences and knock-on, and I understand that, believe me, and we work on that too. What we really need to do in order to get the situation immediately under control is to slow down the rate at which people come into the hospitals. And to drill further into that, now this may seem micro, but again, this is a characteristic of crises, which is you've got to really look very, very specifically at you've got to look for levers. You open your toolkit, and this is what the federal government, frankly, should have done some time ago. Now they begin to open their toolkit. This is what state governors have been doing for the past 2 weeks. They open their toolkit and they look inside, and the question is, what have they got? What have you got that could make a difference? And of course, one of the problems that state governments and governors are struggling with is that they have many tools in their toolkit, but those tools were designed for hurricanes, large snowstorms, and some places earthquakes. Few of those tools are particularly helpful in this set of circumstances, except of course the dramatic shutdowns and lockdowns that we're all currently experiencing, which have then the knock-on economic consequences, again, that we could talk about that. But if you want to slow down the rate at which people who need acute and critical care arrive in hospitals, I would suggest, and again, this is Retsev's insight, is that you need to look, let's think of this as upstream, but you understand we're looking at what happens before, who are they coming from, and what generates these waves of hospitalizations. And our analysis, which is based on looking carefully around the world, including a deep dive into Italy, we have a very good data team that has already done this, and they have a paper under submission at a top journal. The key point is clusters of infections that occur where vulnerable, high-risk people live close together. Where would that be? Well, Seattle obviously demonstrates that nursing homes, meaning skilled nursing facilities and assisted living facilities, are highly vulnerable to this. And as I'm sure you know, that there's a long and difficult history of attempting to control outbreaks in nursing homes, including coronaviruses. Obviously, this is not the first coronavirus. It's not going to be the last coronavirus. I don't see any reason why it would be the last. Coronaviruses generally pass through nursing homes and do a lot of damage. Now, this one is much more damaging. So we are very focused on helping those people and on building an information system that would allow local, state, and federal decision makers to not just stabilize that situation, but also to get ahead of it, right? So I'm a macroeconomist. I work on finance. I work on economics. I work on growth. I also work on crises. And many of the previous levers, fiscal policy, monetary policy, other policies may well come into play. But I'm telling you today, on March 30th, that is still at its core a public health crisis. And within that public health crisis, the deeper core and the real problem that needs to be, there are many problems. One problem that needs to be addressed, and addressing this, let's say it's necessary but not sufficient for stabilizing, is to prevent clusters of outbreaks in nursing homes of the kind that was seen in Seattle, is now seeing that in Massachusetts, and we are working very actively with appropriate state officials in a supportive role, complementing their efforts and understanding. And we're coming at this from a data analytics perspective. So there are a lot of data about what's going on in the United States. That data is incredibly fragmented. Of course it is. We have a deliberately fragmented society. That's actually a key thought we inherited from the people who wrote the Constitution. And our healthcare system within that fragmented society is even more fragmented. So I'll show you, after we do a round of Q&As, I'll just say a few more remarks now. We'll do the Q&A, and then I'll come back and show you some of our analytical work and illustrate some of these issues of both the extent of fragmentation and how much more powerful we will be collectively against COVID-19 when and if we pool our resources in an appropriate manner. And yes, of course, we're MIT, so these are not words, this is solutions. We have systems, we have the best people in the world working on these solutions. We have information systems to underline recommendation systems, and we are bringing on board real-time data to make that happen. Now, I should emphasize that we are actionable intelligence and operational recommendations. We, the COVID-19 Policy Alliance, Simon Johnson, Rich Savledi, and the amazing people who work with us, we are not in charge. We are not the executive branch at the federal level. We are not governors. We are not mayors. We will work with anyone and everyone. And by the way, whenever we have ideas and proposals that we think could move the needle at the national level, we take those to the federal government. We put them before them in an appropriate manner. I know how to write the one-pager. I know how to back that up with the details and how to be convincing. I know how to work the channels, and I know how to put the memo in the hands of the decision maker. And anyone who wants to work with us, of any background on the executive branch, we work with them. But in the post-virus world, at this stage, there is no time. So we'll work with anyone, and we work through channels, and we always behave in a responsible and appropriate manner. We're MIT, of course, that is what we're about. But when people don't get it, or people can't, for whatever reason, act in the direction we recommend, and by the way, I don't believe that our recommendations are always the best or the only recommendations. Of course, that would be ludicrous. But if somebody says they don't agree, or many times they say, we agree, but we can't do it now for whatever reason. You know, I don't have any emotion or anger in the post-virus world with regard to that. We move on. We offer to work with people, and I can, actually, I'm not going to tell you in this public forum exactly who we've approached and when and how, but we've been to the top people in the country on the government side and on the side of Congress and in the private foundation world. And we've had very good conversations, and we've always been extremely polite. And we continue to make constructive suggestions, and we will. I promise you, work this very hard until the end, and then we'll keep working. But we don't wait. We work things very hard every day, and at the end of that day, we take stock, and then we move on. We run our operation 24/7 because the virus doesn't take the weekend off, and we mobilize and engage every potential available resource. And what I would say, and I'll stop on this, Sherry, and we'll go to questions. I would say that, and you've probably heard other people say this before, all crises must end. That's true, right? We don't live in a state of perpetual crisis. I do think that the role of crises and how we think about them has changed. I'll come back to that towards the end of this session. But all crises must end. But here's something else that's true about crises, which is, and so we're slipping into the cliches here, I understand. You know, sometimes the cliches have a real basis, and they have some bite if you think about them in the right way. So either in any deep, serious systemic crisis like this one, either you go big or you go home. And go big means you find the package of measures that move the needle, that change the game, that are not trying to address a problem of last week or yesterday or even today, but you'd put forward measures that you know with some sufficient degree of clarity are going to prevent the problems of tomorrow and the problems of next week. Now, we are not there in this country at this time. I will absolutely say that. I think we can get there. I don't know when. I know we are working very hard to help all appropriate decision makers get to that point. Because the alternative is the go home. And go home, I don't know what it looks like exactly. I don't know the extent of human damage. I certainly don't know the extent of the economic damage, and I'm not focused on that yet, because first we have to stop the human damage. Everything flows through the humans and the people right now and their fate. But I do know that there are many decisions to be made that are consequential right now, and we, COVID-19 Policy Alliance, are absolutely not in charge. We are attempting to collect actionable intelligence, and we intend to make operational recommendations that will limit and reduce the human damage from COVID-19. That is our entire focus. And we'll do some Q&A, and then I'll talk some more about our specific strategy and what I can share with what we're actually doing on the ground today and this week. And then I'll be laying out some ideas for how ways that people like you, and I mean specifically people like you, can absolutely get engaged either with our effort or the other many really good efforts that are on a convergent track right now across the country. So Sherry, let's do some question and answer now.
Okay, absolutely. So the first question that has the most votes is, Simon, when this crisis is over, how do you think the world will be different? What businesses will not survive, and how will our way of life be changed? So that's a packed 3 questions in one. But
right. Look, I think that's a great question, and I think that in some ways that may be the best question to start with for all our conversation with everyone. My view is that everything has already changed, in the sense that this wasn't the first coronavirus, so why would it be the last? I already said that. I think it's pretty self-evident. This coronavirus profiled older people and people with certain comorbidities that I described. The next coronavirus, and that's, of course, that's the evil superpower of the coronavirus, everyone can carry it, everyone can pass it on, some people die. The next coronavirus could have a different profiling. It could profile younger people. It could profile children. Now, once you've had that thought, and once you've heard it from me or from someone else, and I know this thought will be going around the world very quickly, is going around the world very quickly. Once you've had that thought, you realize that we cannot allow, we must not permit the coronavirus to take our children. That's one. Second, we look around the world and we realize there are people and places that are not as catastrophically affected currently or in this cycle by the coronavirus as we are. So China has had one path, but Singapore has had another one. Taiwan has also kept under control. South Korea appeared to fall behind, but then managed to get ahead of the disease, and so on. So then we ask the question, okay, how is it that these countries that exist at different levels of prosperity with different social and health systems, how is it that they have managed to withstand the coronavirus, whereas we are apparently what I would call I think this is a war, frankly, a war against the virus. And in this war, there are going to be many battles. In this battle, which I would call the battle of the surge, where the infection surges across the country, this is going very badly for us. Now, there will be other battles. There will be days when we win more than we lose. But today is not such a day. So I think, Sherry, this is how I position the answer, which is when we come out of this and when we have the opportunity, everything we do and everything we build and rebuild will be with the consideration of, okay, what happens when this infection comes back around? So many experts, I'm not a virologist or epidemiologist, but I talk to them plenty, and they are convinced that there will be a second round and a third round later this year or in the winter. So we have to consider that. Other people who are sufficiently expert are convinced that we will have another coronavirus before too long. I don't know, honestly. What I do know is that we must build resilience into our system, and we have a system, we were operating a system that was efficient in many ways and supported a high level of income and living standards for many people, not all, of course. But it wasn't resilient to the coronavirus. So at least we're going to build that resilience into what we do. And I think what's going to happen for people in this audience is there's going to be many questions about, okay, we were doing this with this focus, and that was good for the steady state, efficiency-oriented economy we had before. Now we're going to pivot and be very focused on, for sure, maintaining efficiency, yes, please, but also building resilient systems where we're going to think about, I think, concentric circles. There'll be an outer perimeter defense. There will be a perimeter behind that if the virus gets through that perimeter. And then there's going to be a deep, strong core, which we can continue to operate, even if the virus gets through that second level. And right now, all of those systems are in trouble. So I think, Sherry, the short answer is everything changes because it's a new, dramatically different post-virus world.
Thank you. The next one, let's go to another one. maybe a little controversial, but how is the relationship between China and the United States going to look in your mind post COVID-19?
Look, another great question. Thank goodness at this moment, this week, that China's pandemic is behind it, and they are therefore willing to sell a large amount of personal protective equipment, PPE, a term which I think most of you are quite familiar with now. And thank goodness that the federal government has, let's say, with some external encouragement, realized that the way to get that PPE, you need a lot of it, and you need to airlift it in an emergency fashion across the Pacific. So there was a Russian flight that came in, an airbridge cargo plane came in through Anchorage last night to LAX. I can send you the screenshot because we watched it on FlightAware, and that's good news. That's reinforcement. So thank you, China, for helping us through this difficult moment. Obviously, there are, and as I said, first thing in the crisis is you stop the crisis. Now, clearly there are questions to be considered, including food safety in China. Retsev Levy actually and Yasheng Huang, another colleague at Sloan, have done a lot of work on this, and they can really pinpoint exactly where the issues are. That has to be looked at. By the Chinese authorities, right? Of course, it's their issue. I think trade and the nature of trade is going to be called into question because, what if China's pandemic was still active now, or they were worried about it being active? I think everyone in such a crisis must look after their own family, friends, neighbors, state, country. That's you might wish it to be different, but it won't be different. That's the nature of this kind of emergency. So, and you can see it in Europe right now. The European Union has had a lot of friction about whether those countries will sell to each other goods, medical supply goods in particular, that they feel that they will need. So I would be very surprised if after this is over, anyone is comfortable with critical medical supplies or pandemic response equipment of any kind. And that's going to be a long list, right? I don't think anyone's going to be comfortable with those supply lines running across international borders, at least not for the United States. We're a big country. We have a lot of people who previously worked in manufacturing. We can set up and run very efficient manufacturing if we put our minds to it. It should be regarded, it will be regarded as an unacceptable and frankly, completely avoidable and stupid risk to run our supply lines across international borders in the same way. We must be able to have a core of activity and a defensive perimeter that is resupplied entirely within the United States. Now, we're not there yet. We have to get out of the crisis phase. Thank you, China, for helping us. Thank you to everybody in the overseas network of China and China's related people, particularly those connected with MIT, who are being incredibly generous and helping us through this very difficult time. I am sure that we will remember this, and I'm sure that we will be grateful. And I'm sure, Sherry, that we will find a way to cooperate with all nations, because the virus doesn't care about your party affiliation or, the precise nature of the politics that brought the president or prime minister to power. No, the virus, it profiles indiscriminately and kills indiscriminately. And this is an enemy that the world has, not an enemy the United States has. The US is in trouble. The US is losing a battle right now, and we've made mistakes, and our systems are vulnerable, and we must turn this around. But as we come out of this, we're going to need to cooperate with countries, all countries, including China, to reduce the risk to our children and others going forward.
This is just a follow-up to that, Simon. I'm just curious, excuse me, what are the chances that there will be another wave in places like China? I know I was on the phone with people in Singapore, and there was another wave when a lot of the college students came back. So what are the chances of continually waving in places like China and the US and in Europe?
Well, look, I think you have to expect that there'll be various rounds of reinfection with different causes, just the nature of this disease. Again, this is what the experts tell me. And I think you then have to look at the systems you put in place to test people, to trace, if they're positive, to trace who they've had contacts with, and to also provide treatment. And so one thing that we're obviously seeing, including in China and Singapore and Taiwan and South Korea, is different systems, but systems being put in place to catch any reinfection and to provide support to people who are infected, to help them, and to enable anyone who was in contact with them to understand that they're at risk and to go into self-quarantine and to protect them also. So I think, Sherry, that the thing we have to do now is stabilize the crisis. Second thing is start to come out of this, including by reopening the economy when appropriate, and do that in such a way that we can prevent the highly likely reinfections from becoming another system-wide problem and another series of lockdowns. And in fact, maybe we can run the first poll now, which Katrina, will be the poll about when people think the economy will be able to reopen the economy. And as initially I was going to say, well, you can see we put some dates there, and Katrina will show you the poll, and we're trying to be quite realistic, but this is not a joke poll. I mean, I am trying to get a judge of people's sentiment and their sense of when the government, the federal government, because it's obviously ultimately got to be the federal government, will be able to lead us to a safer place.
The poll?
I think they're working on the poll behind the scenes. Sherry, do you want to ask another question?
I have another question, which is very much in line with that. I guess we should have the poll till we ask this next question, so I'll move to the second one. Post COVID-19, as companies disband their respective internal COVID-19 task forces, what new groups do you think are needed to help companies prepare for future disruptions or handle post-COVID measures? What gaps in businesses do companies need to mind?
Okay, and let me just say to the very smart people who are running this behind the scenes, I'm going to focus on Sherry's questions. I can't process the other instructions you give me right now. So look, I think that Sherry, that everybody needs to take a step back, which is very hard at this time, right? For a very short while, and really focus on, what's driving this crisis, what's going to turn the corner, when do you think it's going to happen, what role do we have to play, what role can we play in the stabilization phase, how can we help local, state, federal government, how can we help the vulnerable people, including, I would emphasize, nursing homes who need a lot of help, and we have some particular frameworks and ideas how to do that. So I think in the immediate crisis frame, Sherry, I would throw everything at this, not in a disorganized way. I was a soccer coach on my daughter's soccer team for about 12 years. I am fully aware that having small children all chase the ball around the field doesn't work very well. So we need to get organized. And we have a very organized alliance that we're working with. We have some companies, some very big companies working with us, some of whom I can give you the details, some of them don't want to be mentioned for various reasons. I think I know other alliances with other focuses, and I'm happy to field questions. People can email me afterwards, and I have a team of people who will tell you what's going on, tell you what we know, make suggestions about how to get engaged. Massachusetts in particular, as you might imagine, is a hub for a lot of smart thinking about different dimensions of this problem. And our group works across the whole vertical stack, but we're certainly not trying to propose the solutions across the whole stack. We're trying to encourage them, find people, move things along, catalyze it. The motto that I have, and I encourage everyone in our organizations to say something similar to themselves, is one day earlier. Our goal is to find solutions, move things along one day earlier. So if we move anything one day earlier, we are very, very happy. I do think, though, Sherry, there's a part two, which is as we come out of this, and clearly we will come out of this, in the go big or go home version, then people here need to start. I would strongly encourage people attending to think about how to reposition themselves and their activities to support resilience at an industry level, at a local, state level, and ultimately at a federal level. Now, I know that's hard because there's a lot of government decisions that have to be made that feel like they're out of your hands. But I think this is a time for sensible, structured advocacy. I think, look, there's 290 people on this in this discussion right now. I don't obviously know what all of them do, but I would be extremely surprised if there's anybody listening to this who doesn't have a contribution, an adjustment, a thing to do that's going to contribute towards resilience. And I think, you know, the kinds of people who look at these videos and who engage with ILP and engage with MIT are going to be not just successful, they're going to be crucial as we go forward. There's a lot of investment to be made. There's a lot of repositioning to be done. I recognize that the private sector may have difficulties in leading that because obviously there's a big shock and confidence is affected and it's hard to come back and the direction is not completely clear. And these things are all disincentives to private sector investment. I am recommending, I will be recommending, I have in the past recommended as well, that the public sector lead with some strategic investments, including supporting and strengthening science. However, and Sherry was kind enough to mention the book I have with John Gruber, Jumpstarting America. That book was written in the pre-virus age. It does need to be, we do need to update it to the post-virus age, but mostly by saying, look, it's clear what the enemy is, it's clear what the priority is, and it's clear what we need to do is build a more resilient system. In that resilient system, public investment in science and technology, fundamental basic knowledge with big spillovers is very important. But I do not recommend, even in these difficult post-virus days, certainly when we come out of this, I do not recommend that federal government take over activities that are more appropriately done by the private sector. What I recommend, and we're recommending, is that the private sector reposition itself into activities that are complementary with what will be our new national priorities, which will be obviously not only COVID-19. Of course, there are other issues that we must deal with, but we will see everything through the lens of the COVID-19 experience, the damage that it does, and our fear about what could come next. So that's why I said I'm very happy to be talking to you guys today, right? Because it's a process. We have to get our minds around. We've got to follow this together through this. And you know, I'm certainly not claiming that today I have all the answers, or even that I'm asking all the right questions. But I think this process we have to go through, and I think it's the sooner we start it and the more we engage with each other, the better. Because we're all problem solvers. Everyone on this call has a lot of experience in life. Everyone on this call, I think, understands the value of ideas and how you need to update ideas when the facts change. Well, the facts just changed in the biggest way ever in our lifetimes. There is nobody on this call, I would contend, who has experienced a shock and a change in the nature of the world as profound as the one that we have already experienced, because we're already in the post-virus world, and where now the implications are unfolding before us.
Let's return to your remarks, Simon, as we've got about 20 minutes left. I want to make sure we have plenty of questions, so that's not a problem, but I want to make sure you have plenty of time to conclude your remarks. So let's go back to that and we'll finish the time with Q&A.
Right. So let's talk about crisis and crisis management, and at least this is how I think about it. It's based on, you know, a pretty substantial amount of experience, but I'm sure other people have their own heuristics. I think in any crisis you start off behind, in the sense you wake up suddenly like, oh my goodness, it's a crisis. I don't know what's going to happen next. And that certainly is what happened to me. And I think Retzev can speak for himself, but I think he was in the same boat on March 10th. So we set off running really hard. We pulled together our friends, we pulled together, you know, corporate partnerships, we pulled together, you know, people to review and hone ideas. And we started making our proposals to the federal government about 5 days after we started this work. We worked through the night. We were running our operation literally through the night. We deliberately designed to do that, so we can put out more ideas, we can get feedback, we can improve our ideas in that rapid cycle. Now, I woke up after we've been doing this for 1 week, and you know, we were all pretty tired. And I woke up and I said to myself, oh, we've been doing this for a week. We've been working flat out. We've got some of the brightest people in the world, and including people from the EMBA program at Sloan, but other Sloan students as well, working this hard. And we haven't got ahead. We might even still be behind because it's Wednesday. I said to myself, it's Wednesday and we're still behind. But then I realized it wasn't Wednesday. It was Tuesday. See, we had run ourselves so hard, and the people on our team, and it's not me, believe me, it's not me. It's the people I'm working with are unbelievable MIT origin, MIT connected talent, okay? That's just how it is. In the post-virus world, I tend to be fairly direct, because there's no time for messing about. So these people had worked so hard and so intensely that we were a day ahead of where my brain thought we would have been. So I said to the people around me, right, this is the next stage. You know what you're doing today. My job is to think about tomorrow. So that day, all I worked on was what we were going to do the next day. On Saturday of that week, I woke up and I was thinking about Monday. And on Monday or Tuesday, I woke up and I was thinking about the next week. Now, of course, it doesn't mean that I'm prescient. It doesn't mean that I know what's going on. But it does mean that the proposals we're making are not proposals that would be relevant or helpful had they been proposed a week ago or even yesterday. The most important thing for certainly policy making, but I think this is also true of all. I mean, I'm running a large, spontaneously created, entirely volunteer organization that's growing extremely rapidly. Perhaps it's certainly more rapidly than anything else I've ever observed or come across. We have an exponential enemy. It grows at an exponential rate or close to it. You do not beat an exponential enemy by focusing entirely on arithmetic forces or boosting your arithmetic forces, boosting your forces by adding ventilators, for example. If I add 10 ventilators, that may help, but it's not going to beat the exponential virus. You need exponential capabilities. You need a big alliance. You need a lot of people. And it's not just us, you see, it's people on convergent tracks. And a big part of my job now is to find people who are converging with us, to build those partnerships, to make sure we mesh with what they're doing, because then the effort becomes more coordinated and bigger. And it's not me. I'm not going to save the world. And even our organization is not going to save the world. But the convergence of smart people with good ideas working this problem hard is definitely going to make a contribution. So specifically, and let me show you, I want to show you one slide, because, and I will circulate all of these slides subsequently, and you can look at them all and you can come back to us with comments. This is the version, live version as of this morning on March 30th, but we run through a lot of cycles on this also. So I'm going to, if I'm allowed, share my screen. And it is letting me share my screen. And I'm going to go up here. Okay, it didn't share the right screen. Hold on. Here we go. So look, I'm obviously not going to go through this. We can have a longer discussion about this. But we'll send this around. This is the data and this is the analysis the strategy. You got to have a strategy, right? And I think that I am not going to comment in this forum on the strategy being pursued at the federal and state level. Okay, I'll talk with you about it separately if you want. But our understanding and our analysis comes from what I described, the concern about the clusters of infection flooding into the hospitals, crashing the systems, and knocking the hospitals offline. And we regard that as their operational priority number one, to prevent that from happening. Now, this is analysis done by Vivek Farias, who's also on our team. Vivek is a brilliant mind. I think we could put him under the heading of operations research, but I think he's a lot more than that. He previously ran a very successful hedge fund. He just sold a company for a lot of money to a major corporation, and he is now working flat out on this. And this picture, what you see, this is for Massachusetts, and we can do this for every state. What you see here is that. And these are all hospitals with emergency rooms and ICU capacity in Massachusetts. The red dots or the pink dots are what will happen if you have a certain infection rate and people rush to the hospital they usually go to when they have an emergency. So this is let's say existing demand pattern, and into that you feed the infection. And with a certain with our current understanding of the people who need hospitalization and also ICU care. Those are the pink dots. And what you can see here, you see the patients per bed at the bottom, and obviously when you have more than one patient per bed, you're under a lot of pressure. If you're over 3 or 4 or 5, I don't think you can continue operating, or at least the degree to which the hospital can provide effective emergency services is going to come under great pressure. Let's put it that way. Now, if you were to load balance or resource balance, in other words, you share capacity across the entire state, then you could get to, or the optimal allocation would be shown by the blue dots. And basically the intuition here is, look at the top. Mass General, Brigham and Women's, Beth Israel. In the default scenario, they have patients per bed about 1.5, or even under 1.5, and they're fine. It's the smaller hospitals that crack in that model. If you load balance, then you can see that the big hospitals are basically providing the backup to the smaller hospitals. They're going up to 2.5 patients per bed, which I would emphasize is a lot of pressure on those people who are just amazing heroes to me and to all of us. And everything we're doing is trying to reduce human damage and support those heroes. Let me be quite clear. And we are not on the front lines. We are trying to resupply and help people on the front lines because their condition is so desperate. But look what happens if this is done at the state level, and it might happen at the state level, and it might not, frankly. Then you get much better outcomes. Fewer hospitals are going to crash, and it's entirely possible. And I want everyone to hold this idea clear in their minds. Massachusetts, if we pool our resources in a better way, or even in the best way possible, we might get through this with relatively little damage across multiple dimensions compared to other parts of the United States that are now under tremendous pressure. Look, I don't know what's going to happen. I don't know what policy is going to be. I'm not the decision maker. All I can do is make recommendations. Now, obviously, in order to make this, to get to the blue dot system, I can't just give a slide to the governor and say, right, here you go, make this happen. Well, I could do that, but it's not likely to be very effective. So what Vivek and his team and Retsev are doing is building a real-time information system that will capture, record, and communicate available capacity at hospitals, run that through the EMS and to the testing stations, because everyone should be tested before they come into the hospital to protect the hospitals from being infected. And on that basis, route in real time the very courageous ambulance drivers who are moving people around. The current policies that we have in place in some American states, and obviously it varies a lot by state, and I get that, and I'm not trying to overgeneralize here, but I do know some states, or let me speak about one state without naming it, where the decision rule is that the ambulance driver loads the patient, and on the basis of his or her knowledge of available capacity to deal with that kind of patient, they set off rapidly in that direction until the hospital rings up on the telephone EMS and says, we're full, don't bring anyone. And then an ambulance diversion program gets in progress. This is a pandemic, people, okay? Pandemic, you don't want to be relying on telephones and getting people to answer the telephone. You need, and we are building, and we are recommending that people adopt a real-time system that will communicate where the beds are available. It will do the optimization that Vivek, that's Vivek's slide. It will re-optimize in real time and allocate patients in a way that will save more lives, keep more pressure off the hospitals, protect the doctors and nurses and other people on the front line. So, is this a magic bullet? If we have the data and people listen to us, do we save the day? No, of course not. It's a pandemic. Does that mean we should hide in our homes and wait for the virus to take our family and friends? I think not. That's not what I'm doing. I don't think that's what you're doing. I think that's not what people in and around MIT, people who interact with ILP, I don't think that's what any of them want to do. I think we need strategy. I think we need to think it through. And we have done some of this, but for sure we could do with your help and your ideas and your engagement. And anybody who wants to contact us and follow up with me, sjohnson@mit.edu. I hope I will have a flood of 274 emails immediately, in which case I will be involving my team in managing those. And we will build bridges and we will make connections and we will work the entire stack of COVID-19 problems to the end. And then we'll come out the other end. When we've stabilized that, we're going to come out running hard and get to work on the economic, financial issues to reboot the economy. And when we've rebooted, then, Sherry, we're going to go back to the jump-starting ideas and say, look, it was very damaging. It was difficult. We're out of the woods, but now we need the real jumpstart. Now we need to accelerate. Now we need to create more opportunity for more people. And then we're going to really take on the global issues. Because, look, why would you want to live in a world that generates such viruses? Why would you want to live in a world in which it's easy for the virus to run through certain, people in our own society, by the way, also, and spread? No, I don't want to live in that world. I refuse. I refuse to sit back and let the coronavirus take my children or my children's children or your children. I refuse. Does it mean I can stop it? No, maybe not. Does it mean I should work hard on this for the rest of my professional and productive life? Yeah, it does. Actually, it does. And that's what I'm going to do. And I invite anyone or everyone to join us in this. And you know, if you can't join us, if whatever reason, that's also fine. I mean, we move on. In the post-virus world, we always move on. And there's no animosity, there's no regret, I find in my life right now. There's just work. And we work with anyone and everyone who wants to proceed on a convergent track. And because we will converge and we will figure this out. And you know what? We are the private sector. But we're the private sector in the post-virus world, which is a little bit different, I think. I see a reconfiguration. I see some different capabilities being mobilized. And we will work with the government. We'll work through the government. We are always going to be respectful of the government. And at least my group is actionable intelligence and operational recommendations for all levels of decision makers. But they have to make the decisions. I think we are now building the systems that they currently need and they will definitely need. And we are attempting to look forward to what is coming and help people get ahead of both the crisis and the recovery and what I truly believe will be and can be and should be the new next jump-starting of the American economy. Thank you, Sherry.
Thank you, Simon. We have a couple minutes for questions. I'm going to ask a couple more. I want to go to the one that we missed from a participant the last time because we were not able to do the poll question, so we apologize for that. But in the meantime, what are the key indicators to allow business to restart?
So here's the interesting thing about this virus, right? I have a couple of teenage girls, and I don't think I've watched every Marvel movie, but I have watched a lot of them. And it seems to me that when you have an enemy with an evil superpower, the first thing you want to do is consider how to turn that superpower against it. So imagine a world, which is not this world at this moment, be careful, but imagine a world in which we could secure every at-risk American in their home, which would mean providing them with food, medicine, and telehealth on an appropriate basis, paid for, yes, in whatever means we decided was sustainable. But we provide them with food, medicine, and telehealth, so because they need to talk to a doctor. They may be afraid, they may have existing conditions, and they may become infected or fear that they're infected. If every one of these at-risk Americans, say people over the 65, we'll let the clinicians make the call, but 65 is the current number, and people with sufficiently dramatic, serious comorbidities, if they were all safe in their homes, the rest of us could go back to work without fear. Now, that would give us back maybe 90% of our economy immediately. Now, what I propose was expensive, of course, but what's the expense of being locked down for, my base case is 2 months, but there's a pretty big error band on that, and error band is mostly on the longer side. Or it's on the side of we reopen the economy and then it breaks out again and we don't control that. And so then you have a more general, an extremely damaging lockdown. And once people believe that, you got to open then shut, then maybe you'll open and shut again, that really hurts investment because, why would you reopen your shop if you're going to have to shut it down again and lose everything again? No, it won't happen. So we are working to build the systems that would make it possible to do what I described. Now that's hard. And I do think obviously that testing and a testing, tracing, treatment strategy needs to be developed. I do think if we can, and other people I'm aware of are able to work hard and get somewhat lucky next 2 months, we could build a system which, okay, let me withdraw the 2 months remark. I don't know when this could happen. Over a reasonable period of time, if we work hard and we're lucky, we can put in place systems that would allow us to reopen a lot of the American economy, maybe all of it, and then to monitor, control, limit the impact of any reinfection. And basically, my team, led by Retsev and Vivek, is building an information system that in real time could allow, for example, a single centralized federal COVID-19 command center, which I would also recommend they establish, with a lot of emergency powers to say, look, it's gone red over here. The measures we're taking are this, this, and this. Would that need to be a complete lockdown of that area? Not necessarily. If you build the right system, look at what South Korea did, or look at what other places are doing and have done. The tools are out there, and we have plenty of capabilities. We've got technology, we've got people, we've got companies, and we have people in government who understand this in the United States. What we don't have currently is systems, and what we don't have currently is capabilities that are deployed in an appropriate forward manner to anticipate and forestall, for example, reinfection.
Excellent, thank you. Okay, let's ask one more question before we end. What kind of industries do you think should collaborate more to help recover from this situation? I know you're working a lot with industry, so.
Well, look, when I say there's a stack of problems, I mean that literally. So you need to bring PPE in from China. You need to build domestic manufacturing capacity. Clearly, that capacity has to go into distribution channels. There also have to be efforts to resupply and support these nursing homes that are in the immediate line of fire. There also have to be efforts to identify and help all other vulnerable people who may live independently, but they live in clusters. And this is part of what happened in Bergamo. In Bergamo, there were a lot of older people living together. That created a cluster effect without, we currently believe, there being a particular nursing home forcing event, if you like. Now, that I described, that vertical stack, I think could do with the eyes and the efforts of pretty much everyone here. How about this? If there's someone listening to this who believes they have nothing to contribute to either the emergency phase or the immediate sort of turnaround recovery phase, they should email me to explain why they have nothing to contribute, because I can't see it right now, honestly, Sherry. I think that everyone, you need a plan, and you need a strategy, and you need to decide what that is. We have one that I'm sending around. You may decide we're wrong and you want to pursue another one. That's fine. But I think within that plan and strategy, which you can organize at your company level, you can organize it at the level of your association, you can organize at the level of your locality, your community. I think that we can all find ways to contribute. Can I specify exactly the ways people can contribute? No, I can't. And that's a good thing, because you know what? It's a big, diverse set of individuals, brilliant individuals who run this economy and who innovate. And every day, this is the fun part of what I do. Every day, ideas come to me inbound, or I connect with people, have conversations, and I learn things that are going to be incredibly helpful, like immediately, particularly if they get linked up in the right way with other pieces, things that I never imagined, things I never thought of. Like, oh wow, yeah, of course, that's a good idea. And that's the nature of our society, Sherry, and that's our strength. Our weakness is we're fragmented, we're facing the wrong way, the enemy is behind us, and my recommendation is don't give up, never ever panic, because good decision making you don't make good decisions when you're panicked. Have an overall idea of what's happening, have a strategy, or understand what strategy you're willing to support and what's going on, recognize who the players are and what they're doing, and then apply yourself. And when things work, do it more. And when you give people tasks and they excel, promote them. And when things don't work, move on. Every day, move on. Because that's how we're going to get ahead of this, and that's how we're going to turn the corner.
Well, thank you very much, Simon. I'll turn my video on quickly here. Thank you so much, Simon. That was incredibly helpful. I want to let the folks that are still on the call here, or on the Zoom, that this is the second. We have, as I mentioned, our first series was presented on March 16th, including covering topics like supply chain, society, and financial systems. All of these webinars will be available on our YouTube channel and also available on our website, ilp.edu. We will be hosting roughly one a week. We also have our autonomy conference coming up starting next week. That is going to be completely virtual and broken up into 4 days. So we're continuing to operate here at MIT in this virtual world. So please join us as we bring folks like Simon back in to talk more about what the progress of the COVID Policy Alliance that he's leading, as we all navigate through this very, very crazy time. So thank you, Simon, and thanks everybody.
Thank you.